Most patients with kidney failure will live longer and healthier lives if they receive a kidney transplant. However, multiple barriers can prevent patients from accessing this treatment option. There's a shortage of kidneys available for transplant, leaving most patients to wait years for the surgery. Some Canadians who would benefit from a transplant die while waiting. But they shouldn't have to. Kidney transplant recipients can receive a transplant from either a living or deceased donor. Living donors can be family, friends, or complete strangers who are willing to give the gift of life. Living donor transplantation has advantages over deceased organ transplantation, including superior rates of graft and patient survival. In Canada, about 1/3 of kidney transplants are from living donors. To improve these numbers, we must identify and break through barriers which prevent patients from receiving this gift of life.
Our Can-SOLVE CKD project focused on increasing the use of living kidney donor transplantation. It aims to address the barriers to this treatment option by improving how efficiently candidates are evaluated for living donation and testing whether a quality improvement intervention can help patients complete more steps towards receiving a transplant. For living kidney donor candidate evaluations in Canada, through our research findings, we now better understand how long it takes, how much it costs, strategies proposed in the literature, how to improve the quality of the evaluation, how patient healthcare outcomes may improve with a faster evaluation, benefits of evaluating multiple living kidney donor candidates simultaneously, and indicators that can be used to measure how efficiently a transplant center evaluates potential living kidney donors. For the second project, we are testing a quality improvement intervention in an Ontario-wide clinical trial called the Enhance Access to Kidney Transplantation and Living Kidney Donation, or the ENACT LKD trial. There are over 10,000 patients living with kidney disease in this trial. The ENACT LKD intervention has 4 main components. 1, local quality improvement teams and administrative support to drive improvements in transplant access. 2, kidney transplant education and resources for patients, families, and healthcare professionals. 3, support from kidney transplant recipients and donors through a transplant ambassador program. And 4, program-level performance reports on transplant performance and oversight and accountability by program leaders.
Patients have been full partners in these research activities, starting with the original project concept through all the steps of the research. One unique factor of this project is that our patients have been involved in developing a solution to improving access to transplant that is now being tested in our trial. Specifically, they developed and are leading the Transplant Ambassador Program, or TAP, which provides one-on-one support to potential kidney transplant recipients and donors, directly from those who have gone through the experience before. Sue McKenzie knows firsthand the power of living kidney donation and the value of this kind of research.
A big gap was not having the opportunity to talk to someone who'd gone through it before and ask them a bunch of questions that you don't necessarily think about when you're in your nephrologist's office and you have such a short time to have that conversation. So having someone else to talk to who can kind of chat through some of those finer details in terms of how did you feel and how long did it take for you to feel better. And it's just really powerful to talk to someone who's actually done it and been through it. And I think it gives you a certain kind of hope that you really need to stay positive and strong throughout the process.
TAP is an integral part of the quality improvement intervention. All signs to date suggest that it is a big success, and the findings from our trial, which we'll report in 2023, will quantify the impact. The goal of our ongoing research is to contribute to a world where patients living with kidney disease find it easier to receive a transplant, have best experiences doing so, and realize better outcomes, living longer, living healthier, with less healthcare costs.